about this indentation here on both sides. I just feel like I always look exhausted no matter how much makeup I put on. I've always been a little bit afraid of needles, so Tanya told me about the method of using the cannula. So I'm a little bit less scared. So we'll see how it turns out.
Hi everyone, my name is Tanya Patron, physician assistant with Miami Plastic Surgery. I have my patient Christy here today. As you heard, she's been bothered by her little, what we call tear trough. So we're going to be injecting a product called Restylane Silk, and I will be using a cannula. A cannula is does not have an actual needle tip, a sharp point. So I'm going to just make one little small, tiny injection site with a regular needle, and then I thread in that cannula so that there's no other additional sticks or marks on the skin. Going to inject is Restylane Silk. This is a soft product that can be used in the lips or the tear troughs. The tear troughs are a really gentle area, so I don't want to use a product that is very thick. This one is very soft, very smooth, and you'll see after I inject how it just fills in very nicely. This is a cannula. So a cannula, I'm going to go ahead and open this one so you guys can see it. We use one, it's completely without a sharp tip, so no actual needle sticks here. There's a little small opening, so what I'll do is I'll actually thread that into the area that I'm going to inject, and that way the patient only has one stick on each side. This also cuts down significantly on bruising and swelling as well. We put a little numbing cream on here first because she is very scared of the needles, so it's an extra step that we take so that it's more comfortable. I'm just going to make sure the area is really clean. And at any point, if it's uncomfortable, we simply stop. So there's no rush. Okay. I'm going to just use a regular needle tip to make my little insertion point. What I'm trying to do is just thread that product very gently in there. I don't want to fill it up too much. It's really going to help with her profile as well. If you turn a little to the side, you can actually see where there's an indentation there. All I'm going to do is just sort of pillow that skin up very gently so it looks much more natural. I'm not trying to do anything very drastic on her. She's a young patient. We want this to look as natural as possible. Okay, ready? You're going to feel a little stick. Okay. It's going to be a tiny pinch, and I'm going to just pinch you. Okay, 1, 2, 3. That's it. How's that?
Great.
Okay, good.
Okay.
That was it. That's the hard part for you. The hard part for me is to find the hole because I've got to thread it in here. So I don't know if you guys can see that. That's my little injection spot, super tiny. And now I'm going to very carefully thread this in. Okay, you're going to feel some pressure. Are you okay?
Mm-hmm.
Just want to make sure I'm in the right area. Okay, and there is my cannula. Do you feel anything?
I feel nothing.
Okay, so see how easy that is? All right, and now we're going to just pull back. I want to make sure I see exactly where that is. You can see it's right where I want to be. And I'm going to very gently and slowly lay that product down as I inject. So you may just feel the pressure of that. I'm just going to maneuver this again, so a little more pressure. You okay?
Mm-hmm.
Good. And then I pull out. So you should be able to see this pretty instantly, so if you can kind of notice it's already nice and filled in.
That's it?
That's it. So I'm just going to do a little more around. I just wanted to show you guys kind of how this works. And now I'm just going to finish it up. Okay. Do you want to see with the mirror?
Yeah, absolutely. Oh, wow.
So one little pinch.
Huge difference.
Yeah, and it's still you. So again, it's really good to kind of go slow with fillers. You can always come back and add more product as opposed to, you know, having to come in and take it away. If it's you know, something that you're unhappy with, there is a product called hyaluronidase, which is an enzyme that breaks down these particular types of fillers. So that's a really great thing to know, that if you are really unhappy, which, you know, you shouldn't be if you have a good discussion with your provider, but if it's something that you just sort of change your mind, there's always an eraser, so we can get rid of it if we need to, but hopefully we won't have to do that.
Okay, so we just finished. As you can see, it looks completely natural. I was really scared that even right afterwards I would be really puffy and scary looking, but actually I feel refreshed. I didn't feel any pain at all. I didn't really believe Tanya when she told me that it was going to be painless, but it was really easy. So I'm feeling a little brave, so we're going to do Botox now. So it's been 2 weeks since I had my injections. We did a little bit of Botox on my forehead and around my crow's feet, and we did some Restylane Silk under my eyes. I was really concerned about always looking tired and exhausted, like I hadn't gotten a good night's sleep. Like I said, it's been about 2 weeks, so I did have a little bit of swelling, and all that is gone. I didn't have any bruising, which is fantastic. And I'm really, really happy with my results. I don't have to pile on the under eye concealer, and I just feel a little more confident, especially on the weekends when I don't really wear any makeup at all. So I would definitely do this again, and I'm really, really, really happy. Thank you, Tanya.